lovely viewers. Today is yet another edition of Health Talk on News Ghana Clock. Today's topic for discussion is about sexually transmitted infections, which we will delve into a particular one, which is gonorrhea. Here with me is always our resource person, Mr. Micheal Coffie, who would help us in our discussion for today. But before we move into details, let's go for a quick commercial break. Welcome back from that break. Once again, our topic for today's discussion is on gonorrhea, which is a sexually transmitted infection. We will actually look at the causes, effects, and how to solve such problems. Alright, so here with me is our resource person, Mr. Micheal Coffie. Mr. Micheal Coffie, welcome to Health Talk on News Ghana Clock.
Thank you.
Alright, so I must commend, your outfit is so nice. You look so superb.
Thanks for the compliments.
Okay, so moving straight to our topic for today's discussion, what exactly is sexually transmitted infections?
Well, thank you very much once again. And I must say that sexually transmitted infections, as the name depicts, is actually an infection that we can obtain through sex. So if you haven't had sexual intercourse, it's most likely you are not going to contract it. It could be through vaginal sex, anal sex, or even oral sex. So there should be that sex element for you to contract the infection. But then, as you rightly said, we're going to look at gonorrhea for today, which is actually also a type of sexually transmitted infection or disease. The infection will lead to the disease, so sometimes we can interchange it as sexually transmitted infections or sexually transmitted diseases. But gonorrhea is caused by a certain interesting bacterium called Neisseria gonorrhoeae. You know, the name is nice. It's like Neisseria, but it's not that nice because then it can cause a lot of troubles to the person who has contracted it, be it male or female, because it can affect both sexes. And it is actually often passed from one person to another, as I've said already, through sex. There are times that it can affect your urethra or your rectum or your throat. Okay, so for women, it can also affect the cervix, you know, and therefore there are times that it can lead to pain even during sexual intercourse.
Oh, okay. Then I think that's actually pain during sexual intercourse could actually remind us back of last week's discussion, which is sexual dysfunction.
Yes,
okay.
As I rightly told you, when women have certain kinds of infections, they are not able to enjoy sex because then there could be pain. So this is one of such.
Okay, so rightly put, as you said, gonorrhea is transmitted through sexual intercourse with your partner. And so does that mean that if your partner has gonorrhea, you can equally get it?
Certainly, yes.
Okay.
Especially, you know, the male partners easily get it because within a few days, 2 days to 3 days after having sex with a woman who has had gonorrhea infection, the man starts showing symptoms. It doesn't mean that the women don't have it. The women have it, but because they are sometimes asymptomatic, that they don't show symptoms, they are not easily picked up. And because the gonorrhea itself, as you are going to see, doesn't in most instances present any symptoms. And so people might not initially see it, especially the women. But when the men have it, then it tells you that the woman is also likely to have it. So you treat both parties.
Wow. So how does this gonorrhea thing spread? How is it actually spread? Okay,
gonorrhea is normally spread through sexual intercourse, as I've said. It can spread through a male partner having sex with the female counterpart, or the female counterpart having sex with oral sex with even a female partner who has gonorrhea.
So it means if you use the lavatory of someone who has this gonorrhea, you wouldn't be infected, or what?
There are some instances, rarely though, that people might take it or contract it from such infected toilet seats. but then it is mostly spread through sexual intercourse. That's why we say sexually transmitted diseases. Indeed, you can have it through anal sex, you can have it through oral sex, and children, babies who are born to mothers who have gonorrhea can also contract it during childbirth, and normally it affects their eyes. And so these are some of the ways in which gonorrhea is spread.
Wow. So, if a child, a fresh baby, being given birth to has eyes, a problem with the eyes, mean the person had such infection from the mother. Can you please
Yes,
explain better?
as we go to complications of this disease, you appreciate the fact that indeed it can even lead to blindness in some of the children. And so, yes, it may not be exclusively through gonorrhea, but then we have to screen to see whether that mother had gonorrhea or otherwise.
But is that really what causes chlamydia in children or something?
No, chlamydia is actually another kind of infection which is different from gonorrhea. And so maybe later, as we take other sexually transmitted infections, you see chlamydia. But then there are some people who are at risk of getting gonorrhea, especially women who are less than 25 years of age.
Wow.
And one may ask why. You know that women under 25 are normally over exuberant, or they want to explore. And so sometimes they are not even careful to protect themselves by the usage of condoms and other such means. And so they can easily contract it. But from the age of 25 and above, you see that most women get more matured. And so they are really very careful at taking certain risks. And so you see that the incidence of gonorrhea transmission is lower in such women than in younger women. And also, it can also be a risk factor for people who have multiple partners, or people who have a partner who has multiple partners, because then the person can go and then have sex with other people and then get the infection and come and affect you. Or it can also happen when somebody has other sexually transmitted infections. It means that you are more at risk if you have more than even one sexually transmitted infection. You can even transmit it the more to other people.
Oh, okay. So, what are some of the symptoms of gonorrhea?
Yeah, the symptoms of gonorrhea vary depending on the site where it shows. But mostly, you see for men, they will have pain, in the genital after urination, and then sometimes they bring out some discharge, after urination, and also milky white discharge to some creamy to yellowish discharge after urination. And then it can also lead to pain in one of the testicles. Okay, just one of the testicles could be paining that patient, and it's an indication that they might have contracted sexually transmitted diseases. The women also who will show symptoms will also come with some discharge as well, and that is when it has progressed to a much more later stage, because then at the initial stage they hardly present with that symptom. They can also have pain, as we've already stated, and especially in between periods and during sexual intercourse, they may have pain, and sometimes even abdominal, lower abdominal pain and pelvic pains. So these are some of the symptoms. But then there are certain other symptoms that are specific to certain parts of the body that they infect, especially with the rectum. With the rectum, there are times that they come with erectile or anal itching. So if your anus normally itches you, or you bring a discharge from the anus sometimes, or you often see blood, some clean blood after using the tissue to clean, after going to toilet, then it means that there's also a likelihood that you might have gonorrhea. Or sometimes you strain when you go to toilet, it doesn't want to come, you think it's constipation, but it could also be as a
Mr.
result
Michael,
of
this
gonorrhea.
is so educative. Let me chip in this. So, does it always mean that when you go to the lavatory and you want to ease yourself and you're finding difficulties in doing that, it is not always about you having constipation.
Yes.
But it could probably be gonorrhea.
A sign of gonorrhea.
But some also say if they see blood in their stool, it could be that they have piles.
Yes.
How is that so? And then how is that related to gonorrhea and all that?
So then if you are not sure, you have to see your clinician. We can tell whether it's actually gonorrhea by doing some labs for you, or he can examine your rectal passage to see whether there are some hemorrhoids, or what you call piles, in the rectal passage. If they see that, and then you are straining, the straining can rub against that kind of swelling or piles, and so can bring out blood. So the doctor will be able to tell which one is actually which, and then solve the problem for you. There are times that it can also affect your eyes. So you have some eye pain and then sensitivity to light. So, and also you can also have pus-like discharge from the eyes, especially from one or both eyes in the mornings or at certain times of the day. But mostly you see it early in the morning. You have a lot of pus in the eyes. Then it's also indicative that you could have gonorrhea. Then the throat. Sometimes you have frequent throat infection and pain, and then you have inflammation of the lymph nodes at the throat area. Then it means that it could be gonorrhea. Then sometimes the joints, when the gonorrheal bacteria actually passes through the bloodstream, it becomes disseminated, and then it can cause what we call septic arthritis. So you feel joint pains most of the time, and then the place that is actually having the pain will be warm to touch. Okay, and then you can see some redness also there. That also shows that yes, you could be a victim of gonorrhea.
Wow, this is so educative. So it doesn't really mean that if you have a problem with your eye, you should like center it on the fact that probably you are having an eye problem or something, and so you have to visit the optometrist or something to fix your eyes and all that. But you really have to look at series of things which are leading to such a problem.
Definitely.
To know the right thing to do.
Yes, definitely.
Wow.
There you will have to see an ophthalmologist though, because you might not know what exactly is causing that eye problem. But when you see the ophthalmologist and he does all his things and he sees that it is actually not related to any specific thing like infection that he knows of, then we can also do other labs to see whether it could be gonorrhea.
Oh, okay. All right. So following the symptoms of gonorrhea, does it have any implications on the individual, maybe the female or the male?
Yes.
Does it have any implications?
Very. That is where the complications set in, because in fact gonorrhea can lead to infertility in women and also men.
Wow.
Yes, for the women it can actually affect the fallopian tubes by causing some scarring. So like I say, as we say, scar in that area, and can also affect some parts of the womb, and so implantation of the fetus sometimes becomes a problem, and then you can even lose a baby through that. And then it leads also to an infection of that area where we call pelvic inflammatory disease, which could also be a problem for the woman if not treated, and can lead to infertility. Then for the men, it can also lead to a problem with where some part of the testis where the sperm is actually produced, which is called the epididymis. And so this epididymis actually is going to get inflamed, and it's not going to be able to perform its function of producing the sperms that will fertilize a woman's egg for you to have a baby. So then the man might become impotent as a result and cannot make babies. Again, it can also spread to other areas of the body, such as the joints, as I've stated already, and then it can lead to body pains, fever, and then all sort of rash on the skin. Certain skin rashes are actually as a result of gonorrhea. So you don't just treat any rash anyhow. It could have its own serious implications. There could be skin sores, there could be joint pains, there could be stiffness of the joints, in any way. So many complications. And then for those who might also have these complications, they could also be predisposed to HIV. So it is easier for you to also contract HIV from somebody who has it. So these are some of the complications in adults. For children, for babies who are born to parents or a woman who has gonorrhea, then they can come with even blindness or sores on their scalp, and also some infections that they can present. Okay, so these are very serious complications, and if you should give birth to a child and the child is blind, you can just tell how painful it will be. So it's good that we, especially pregnant women, go for screening for some of these things to ensure that they don't have these, and then they can have, or if they have, they can go for treatment, because it can have their consequences on the fetus that you're going to bring out.
Wow. So can these complications be prevented? Is there a way we can prevent such things if one gets such an infection?
Prevention is actually not when you have waited for complications to occur. Prevention actually starts from not getting the infection at all. Okay. And so some of the things that you can do to prevent contracting gonorrhea is what we're looking at. So it's advisable that if you are not married, or if you are not having that license, you know, you don't
that certificate.
Yeah, that certificate, you don't go for it. The best way of prevention is actually abstention. But if for any reason you can't abstain, then you can do the usage of condoms, so that you protect. Yes, no contraceptives, because contraceptives might not protect you, but the condom might protect you, not even that 100%. But it is assumed that it can give you some protection. Again, you have to limit the number of sex partners you have. If you are a lady, stick to one partner that you trust in. If you are a man, stick to one partner you trust in. Don't go for multiple partners. Otherwise, you are actually putting your other partner at risk, your regular partner. And then the women to make sure that when you know that this man is a candidate for any sexually transmitted disease, and how can you tell? Physically examining before the man actually brings the thing inside you. You can do some smart examination, screening. Is there any sore on the penis? Is there anything unusual? Is the person even bringing out certain things that you can?
Then this one is to our active ladies out there.
To everybody.
Yes, but you know, our active ladies are the ones who want to experiment and do all those things without taking precautions, and so they have to make that active screening and then check if the person is.
In fact, you might not even be active, but for you, if you have a new boyfriend and you want to have anything to do with that boyfriend, get tested. Let him also get tested. Look at the results and be sure that both of you are clean, so that when you are engaging in any intercourse, you know that you are doing it without any thoughts that you could contract it, because you have actually gone for your screening.
Yeah, that's I forget. Getting tested thing in Ghana here is really difficult, because I can't go get a boyfriend and then say, hey, let's go test for gonorrhea. It is only for people who are getting into marriage.
Yes.
That is when they tell them they should test for such a thing.
And that's why I have to abstain, my dear. And so if he is also not willing to abstain, and then is this too much to ask? My dear, we are doing this to protect ourselves. We will never know. I might give you an infection, you might give me an infection. Can we just go to the lab and test for these simple things? Testing it might save you a lot of health problems, because who knows? You might even get tested and the person has HIV. How can you tell?
That's very true.
Yes.
So this is to everyone out there. Please, if you are not ready to get married, don't have sex with your partner. Abstain from sex so that you don't get, this gonorrhea and other related diseases when it comes to sex. Okay, so Mr. Micheal Coffie, how do we treat gonorrhea?
Well, treatment of gonorrhea is actually with the use of antibiotics. The antibiotics used will also depend on your geographical location, and then the organisms that are prevalent, the strains, and the relative susceptibility to certain antibiotics that you have. So we normally go to the hospital, they do a test, they let you go to the lab, then the test will come out. If it is positive, then your doctor can also ask for what we call the culture and sensitivity test. When the culture and sensitivity test is done on various antibiotics, then they can choose or select the right antibiotic that can kill the organism in no time. And so I will not be here and mentioning antibiotics, otherwise people will start going to abuse them. As a professional, I'm not supposed to do that. Exactly. But when you go and see your doctor will do all the screening and give you the appropriate medication that is suitable for your particular case.
That's very good. So your last few words.
Yes. My last few words is that my listeners and then viewers, gonorrhea is common. It's all over the place. In fact, when you take the population of Ghana, looking at the world, population of patients who could have gonorrhea, if we are say 30 million, it means that about 162,000 of us could have a gonorrhea at any point in time because of the prevalence rate. So don't take chances. Who among that 30 million and could be part of this 162,000 that could affect you? You will never know. It's not written on people's faces. So go for screening. Don't be callous with your life, because gonorrhea, as we have seen, can even lead to infertility and impotence in men. So you want to wait and contract it to have all these complications. The males should stick to their partners. Females stick to your partners. Males who engage in anal sex with other male counterparts, or even the females, should also be careful. They should have more screening, because going through the anal route, the bruising and other things can easily expose you to more infections. And when you have gonorrhea, please don't self-medicate. Seek professional help. Thank you.
Alright, this is all said by our resource person. If you have gonorrhea, don't self-medicate, but then seek the help of a health practitioner, so that you may be treated, or you can be treated from such a disease. Thank you, Mr. Micheal Coffie. Thank you very much for educating us on Health Talk on News Ghana Clock. Thank you very much, and then we hope to see you another day. This is all what time will allow us on Health Talk on News Ghana Clock. Thank you very much for watching, but please don't forget to follow us on our social media handles on Facebook, on Instagram, and on YouTube, all at News Ghana Clock. Thank you very much for watching this program. Once again, it has always been your host, Kelly Foley. Thank you, and see you next week the same time. Thank you.